The fingers reach the posterior midline of the neck with the shoulder in full abduction and lateral rotation. The fingers reach the midline of the neck but do not have full abduction or lateral rotation. The fingers reach the midline line of the neck but with compensation by adduction. The fingers touch the neck. The fingers do not reach the neck. Hand to scapula. The hand reaches behind the trunk to the opposite scapula or 5 cm beneath. The hand reaches the opposite scapula 6 cm to 15 cm beneath it. The hand reaches the opposite iliac crest. The hand reaches the bottom. Cannot move the hand behind the trunk. The hand reaches the spine of the opposite scapula in a full adduction. The hand reaches the spine of the opposite scapula in full adduction. The hand passes the midline of the trunk. The hand cannot pass the midline of the trunk. Shoulder flexion. The position of the patient is in the supine. The fulcrum is at the lateral aspect of the greater tubercle. The proximal arm is at the mid-axillary thorax, and the distal arm will follow the lateral midline of the humerus. Anvil is firm, and the normal value is 0 to 180 degrees. Shoulder extension. Position of the patient is in prone position. The lateral aspect of the greater tubercle is in fulcrum. The proximal arm is at the mid-axillary thorax. The distal arm is lateral midline of the humerus. Anvil is firm, and the normal value is 0 to 60. Shoulder abduction. The position of the patient is in a supine position. The fulcrum is at the anterior aspect of the greater tubercle. Proximal arm is into the midline of anterior aspect of the sternum, and the distal arm is the medulla humerus. The anvil is firm, and the normal value is 0 to 180. Next is for shoulder internal rotation. The position is in supine. The fulcrum is at the olecranon process or ulna. The proximal arm is to the ground, and the distal arm is lateral midline of the ulna. The anvil is firm, and the normal value is 0 to 70 degrees. Next is for the shoulder external rotation. The position is still in supine, the fulcrum is at the olecranon process, and the proximal arm is into the ground, and then the distal arm is lateral midline of the ulna. The anvil is firm, and the normal value is 0 to 90 degrees.